Study time. Physical changes, causes, and comfort measures. We have spotting and cramps. So a cause can be subchorionic hemorrhage or miscarriage. Things you can do is a heavy 5+ cup Epsom salt bath, increasing oral magnesium citrate, hydrating, increasing protein, applying progesterone or wild lamb cream to the abdomen, double dose twice a day, and a 300 milligrams of vitamin E. So nausea, it could be from estrogen and HCG levels. You want to hydrate, snack, balance your blood sugars, have ginger, B12, Smarty Pants, gummies, or ritual prenatals, electrolytes, IVs, Unisome, Zofran, B6, etc. Fatigue. So energy needs increase to grow a baby, and this also increases caloric intake. Take naps, address anemia or thyroid issues, and things like that. So for heartburn, we have progesterone relaxing the esophageal sphincter. And one thing you can do is avoid water for 15 minutes around meals. Sitting upright, baking soda and water, the reflux gourmet pace with meals is really effective. There's also like thyrozyme or like different enzymes you can take with meals. Smaller meals, avoiding trigger foods like spicy or acidic. Tums is not recommended because it ages the placenta. For constipation, we have progesterone and iron supplements that both slow motility, and magnesium citrate, fiber, hydration, prunes, or laxatives can all be very helpful. For back pain, hip aches, cramps, like leg cramps type things like that. This can be from baby size, weight, position, increasing pressure in the pelvis and affecting different areas. Things that can be helpful can be a heating pad, chiropractic adjustments are great, inversions, where your hands are on the floor and your hips are up to reset baby, stretching, cold packs, Epsom salt baths, massage, a belly band, choosing supportive shoes, good posture, magnesium glycinate, and pelvic floor therapy. So peeing pants, like incontinence stuff. This can be from increased fluid needs and a weak pelvic floor. So pelvic floor therapy is first line, and relaxing, not pushing when peeing and using the bathroom. So actually sitting down, not just squatting. Varicose veins or edema, like swelling. We have hormonal changes and increased blood flow, which is the cause. Things to do are elevate legs, compression socks, massage, electrolytes, stretching, castor oil topically, oral or topical arnica, moving frequently, mountain meadow herbs, variplex, and something that can be a little bit more specific to a localized area, like if it's arthritic type, swollen, numbing pain in your hand, can be using a cast, like a wrist brace at night. Special cases, so primips or a history of prolonged labor. Use uterine toners, pelvic floor relaxation training, because you need to relax to let baby out. Cervical ripeners, a cup of loose leaf red raspberry leaf tea to 2 quarts of water twice a day. 10,000 IU vitamin C, 1 evening primrose oil insert vaginal suppository nightly. 6 dates a day. The Wish Garden Gentle Birth tincture. This can be starting at 35 weeks for primips. And if there's labor activity or like lots of fits and starts with Braxton Hicks, just to discontinue until 36 and 4 weeks when you're closer dates. And I think I already mentioned pelvic floor therapy. For hypothyroidism, so TSH is insensitive to thyroid and leads to high The TSH insensitive thyroid leads to high TSH and low T3, T4. So you want high protein, low sugar, healthy fats. Thyrozyme is a great supplement. Limit cruciferous vegetables. Always cook if you do have them. Organic, grass-fed, wild-caught, good quality foods. Walks after meals, exercise, dandelion, nettle teas, celery, carrot, cucumber, lemon juice, turmeric, cinnamon, ginger, vanilla, golden milk. Or the homeopathic calcarea carb, 200 concentration, 3 to 4 pellets under the tongue, 3 to 4 times a day for at least a month. For hyperthyroid, this is the overproduction of thyroxine, which leads to low TSH, and high T3, T4. So your thyroid's overworked. You should be having cruciferous vegetables. Iron if you're deficient. High protein, limit the iodine, take your thyrozyme, cut off caffeine, have organic, grass-fed, wild-caught, homegrown, all that. Cucumber, apple, celery, cilantro, lemon juice, bugleweed, lemon balm, hawthorn, and motherwort teas or tinctures. Selenium, L-carnitine, omega-3s, homeopathic, iodium, 200 concentration, 3 to 4 pellets under the tongue, 3 to 4 times a day for at least a month. For anemia, so this is an increased need for iron, low folate or vitamin C, or preconception anemia. Those can all be causes. First line, liquid Floridex. You can also take things like Hemovite, beef liver pills, vitamin C, folate, chlorophyll, and last resort, as you're getting closer to dates, is an iron infusion. GBS, colonization of gut bacteria in the birth canal. 30 milligrams of chelated zinc a day. Femdophilus or Thorne Women's Health probiotic. 5,000 IU of vitamin D a day. Vitamin C, garlic capsules. Nordic Naturals omega-3s. Discontinue before 36 weeks to avoid a postpartum hemorrhage, though. HSV 1 and 2. So this is mainly for HSV 1, but the only difference between this is HSV 2 requires some kind of like acyclovir prescription medication to completely manage it, so it doesn't have any flares or risk it. But exposure to HSV 1 positive person via contact with sores or fluid, 10,000 IU vitamin C, 30 milligrams of chelated zinc, 500 milligrams of L-lysine is the main one to keep it at bay, and co-managed care with a prescription if it's, HSV 2, which is more serious. Preeclampsia, high protein, high blood pressure, headaches, spots, and visions. You mainly want the best diet, which is beets, eggs, spinach, turkey, liver glow or some kind of liver-supported milk thistle tincture or milk thistle. Postpartum, we have mood swings. So we have hormonal and physical changes as the cause. Wish Garden Blues Busters tincture is great. There's St. John's wort, lavender essential oil, communication, counseling, journaling, things like that you can lean into. So we also have hemorrhoids. So progesterone and iron slows motility. You can use frozen witch hazel pads, sitz baths, tux pads, fiber, hydration, wrapping hands, and toilet paper for counter pressure because pushing can feel a little intuitive. Magnesium citrate, over-the-counter stool softeners, and over-the-counter hemorrhoid creams to knock it out. We also have postpartum rib pain, which we don't hear very much about. And in pregnancy, it does really suck, but it's due to belly expansion, and wrapping the belly very gently postpartum to allow for support can be very helpful. For mastitis or engorgement, this is often due to stagnant milk in the ducts. And we can use warm compresses, avoid soaps, schedule with an IBCLC, use nipple butters, air out after feeds, correct any latch or tongue tie type issues. You can also try cool compresses. It depends on the person if you like cold or hot. Use silverettes, nurse often, probiotics, cupping, red light therapy, phytolacca 30 concentration, and hepar sulfuris 6 concentration, alternating every 6 hours for 2 days. Relief should occur within 24 hours. Golden seal tincture, 3 droppers daily. Wish Garden Happy Ducks tincture can also be great, and belladonna as well. Please don't be afraid to get on antibiotics if it turns over quickly. Low milk supply. This can be due to stress, diet, infrequent meals, things like that. You can increase caloric intake. At least 500 calories a day is required for nursing. Nurse baby on both breasts frequently for every feed. Pump after feedings. Try Legendary Milk Cash Cow. This one can be prenatal or postpartum. Or Liquid Gold, which can only be postpartum. You can also try Wish Garden Gold's Rue or Maxi Milk tinctures, and traditional medicinals Mother Milk Tea. Blessings to you on your midwifery journey.